Do you or somebody you know have cancer and you're looking at natural options to help treat it or support your recovery and you're totally confused by the overwhelming amount of information out there? Hi, I'm Dr. Patricia Mills. I'm a holistic medical doctor with a root cause approach to health, and welcome to the Wild Wisdom Show. Today, we're going to be diving into natural cancer support, healing beyond the diagnosis, everything about evidence-based strategies that you can use to support yourself on the road to recovery. And I'd like you to meet today Dr. Jess Braid. She's joining me for this episode to share her amazing expertise. She's one of Europe's most qualified natural health doctors. She's supporting cancer patients with evidence-based natural therapies alongside conventional care, and with more than 19 years of experience in functional and herbal medicine, acupuncture, kinesiology, homeopathy, and the metabolic approach to cancer. She truly brings a holistic approach. So thank you, Jess, and welcome to the Wild Wisdom Show.
Thank you for having me.
Wonderful. Well, you know what I'm going to do is I'm going to let you just jump right in and start sharing these strategies, because I have a lot of loved ones with cancer. And when I told them about the topic for today, they were so interested. So I want you to share your expertise. And then I'll have a few questions at the end that they shared with me to ask you for help.
So I've been supporting cancer patients for around, I've been in practice for 19 years, but really specialized in cancer for the last 16 or so. And during that time, I have used all of the natural therapies that I do alongside the conventional. More recently, I have done my training with Dr. Naisha Winters, who's a very well-known integrative oncologist. And I found her approach really complemented what I did, which was beautiful. And the evidence has now really caught up to allow us to do a lot more testing and to really personalize that experience for our oncology patients so that they get the best support and we can give them the right supports, natural therapies for the environment they have driving their cancer.
That's amazing. And one thing that I think, a question I'm going to ask now, because it may influence how you share your strategies, is do these approaches work for all kinds of cancer? Or as you're sharing these strategies, would you say that there are specific ones for specific cancers, or ones that you should really not be doing for one cancer when it works for another?
So there are certain things that work really well for most cancers. And then there are certain therapies that it's really good to see a metabolic or a functional medicine doctor. For example, things like brain tumors, they will respond sometimes that they're a lot more sugar driven. So you'll find that certain diets work much better for that. Hormone driven cancers may have a slightly different approach that you want to work on as well. Blood cancers, things like leukemia, can have a slightly different approach as well. So there is some variation in the approach, but there are general philosophies that you can follow through all cancers. There are some tips I can give you that will relatively be across the board.
Amazing. So why don't we start with those general philosophies? I love that. And kind of thinking about, a patient shows up to your office, what would you start them on? That kind of trajectory, that path that you take your patients through.
So the first thing we'd always do when a patient turns up is we test them, because if we don't know what's going on, then we can't treat them appropriately. So we now have a lot of tests, and they've become a lot more cost effective for us to do, to look at whether sugar is involved in driving that cancer, to look at whether inflammation is a big problem, and to look at angiogenesis, which is a process where the blood vessels grow towards the cancer and increases the rate of metastases. Because of that, we do a set of tests and we have a look at what factors we can see in that patient, and then that helps us target that treatment. So we'd always start with the test process, and then we look at which therapies would be most suitable for them.
Can you give me an idea? So I'm assuming it's like blood work, imaging. Is there some genetic testing? Like, what's a typical panel that you'd run people through?
So we'd usually do a big blood panel, and that would be quite different. I mean, I'm not sure, your health system's a little different than ours, but in ours, it's quite basic what we do in our NHS testing. And we just do a basic set of bloods looking at liver function and kidney function and potentially some tumor markers. But we do a lot more than that. We look at things like tumor driving growth factors like IGF-1, which is a sugar driver. We look at vascular endothelial growth factor, which would look at angiogenesis. We look at all their nutrient levels, because they can have quite a big impact. And if your vitamin D is low, your cancer is more likely to progress and your outcomes are poorer. So we look at everything when we do a blood work panel. Those panels for us are somewhere around about £1,000. It's quite a lot of money, but we only usually need to do them once, and then our other bloods are less. And then we also usually use the imaging any of the hospitals have done. They do a pretty good job of imaging. That's that side they can do. And then we may choose to do more testing on things like toxins if we think that that's got a relationship to it, hormones if we think that's in there. Genetic testing can be really useful to help you work out what drivers might be going on in that person, which things may be impaired, which pathways might need a little bit of help. So I often do a genetic test. That's a cheek swab. So that's quite easy to do. So bloods and genetics are quite common. And those are our main testing methods. Otherwise, I send people back to their conventional doctors to go and have more testing.
Okay, great. Wonderful. And I feel like we could do just a deep dive on that on its own. So we're going to save that for another day. But what I'd like to focus on next, if that's okay with you, is those natural, strategies for supporting that cancer recovery, or maybe even a cure, who knows?
Yeah, I mean, I think my aim with everybody is to look at the fact that, the cancer, is going on in us, but we just want to try and make sure all those bloods are going the right direction, that they were following the right, and that the things aren't getting worse, that none of those markers are going the right direction. And we've got time to do that in most cases. And in the best case scenario, then those markers go away and everything resolves, but you can live a long time if the markers are doing well as well. So, our programs for even the advanced patients is called Living Well with Cancer, because we're trying to improve their quality of life. We're trying to help them live alongside that and not just be a cancer patient. And the biggest strategies that we use, probably my top 3 strategies that I'll use for all patients are diet, which we very strongly look at. And I think that's an area really underutilized by conventional medicine, because unfortunately many doctors, including me, weren't trained very well in nutrition. We had to do a lot of extra training to get to that. You probably did as well. Yeah. And because of that, the patients really have no idea, and a lot of conflicting advice over which diet. But the most common strategy I'll use, and not in every patient, is to look at a ketogenic diet, because of the research done by Otto Warburg, and you can watch Thomas Seyfried explain this really, really well. But basically, cancer cells are a little bit like an engine that just runs on sugar, but your healthy cells can run on sugar or they can run on fat, ketones. So because of that, we can utilize that fact, and we can say, if we restrict sugar heavily, so if we bring your carbohydrates down a lot, then we can have your healthy cells doing well because they can run on fats, but your cancer cells have lost their fuel source. And because of that, that means that it restricts their growth and ability to proliferate if we take down the sugar. So the ketogenic diet is often something that I will use in nearly all cases.
And question for you, there's a ketogenic diet and there's different forms of it. So there's like the dirty keto and the clean green keto, because sometimes people think that doing a keto diet is just meat and butter and eggs and, fats. And that can have quite a high dietary acid load if it's not balanced by high fiber, low carbohydrate vegetables, right? Like broccoli, cabbage, cauliflower, all of these very alkalinizing, balancing effects of the greens into that diet. Is that what you're talking about when you talk about?
I think you should always ideally try and do this with someone who's metabolically trained in it, because keto diet is different when you have cancer and when you don't in many cases. And I think the protein component is quite different for many people when you do keto diet this way as well. We really want to look at healthy fats. That's extremely important. That's why the dirty versus the clean, we don't want the inflammatory oils because we don't want to put more toxins in. And equally, we want to try and keep a lot of vegetables in, because many of those are antioxidant, they're anti-inflammatory, so they're going to have a lot of benefit too. We also want to carefully test to check you're in the right region of ketosis to get the benefit. And not everybody needs to be in ketosis. We can get there by fasting and doing it different ways. But when we are doing keto through things, particularly through conventional therapies, it can be very helpful. Then we want to be monitoring that. We want to make sure the macros are all okay. So you need a good nutritionist, a good health coach supporting you alongside that as well, because it can be a bit tricky. And no, we definitely don't want to do dirty keto.
Yeah. And so you're basically testing your urine for ketones, if I'm not mistaken.
We actually do with a blood monitor called Keto Mojo a lot of the time. It's a bit like a finger prick you do for diabetes. So similar, but it's for ketones. You can wear CGMs and things. We have options, but generally we like to do it at first, definitely, because ketosis is tricky and everyone's a bit different. We like to do it with a blood monitor to make sure it's accurate, get our ratios right, and make sure we're in the optimal zone.
Amazing. That's really helpful to know. So you're, cleaning up your diet, you're cutting out your sugars, you're upping your vegetables that are low in starchy carbs, having your healthy fats, hopefully working with someone to ensure that you're getting the right nutrients in, so you're not depleting your other cells. That sounds all very good. And you mentioned you were talking about that being the dietary strategy. Would you ever change that with any other kind of cancers, or is that pretty much across the board?
Generally, we head towards that diet, but I don't keep, not always. It would depend a little bit on the genetics. There are some people who don't do it quite as well on keto diet, might do not as well on protein, for example, or red meat. We can see that in their genetics, so we often do that as a test. We can also, when we do that testing initially, we can look at things like their blood sugar control, looking at insulin, looking at an HbA1c, and equally something called IGF-1, which is a growth factor particularly related to insulin. If we see those are all really well controlled, then we might not have to go into ketosis, and we might consider doing something like fasting, working with the antioxidants, cleaning up the diet another way. A lot of the time we find sugar isn't a great response. I do these tests a lot, and I would say 95% of people, there's something going on with their blood sugar. Metabolic dysfunction that we can see there is strong.
Yes, and in Canada, we can't do IGF-1, but we do fasting insulin. The specialists can order that. So it's a kind of a proxy, I would imagine, with the fasting glucose calculating the HOMA-IR, that insulin resistance score, which, as you say, most of them will be in the out of normal range. And so it's kind of working to get back within that normal range using these dietary strategies. And for fasting, what is the longest fast? Like, what's the safety zone for fasting with someone with cancer? Because it's a tricky balance, right? Some of cancer patients get quite what's called cachectic. They lose a lot of weight as a result of what's happening. So is there like a safety zone for fasting that you use?
Well, I think you should always be monitored, and having someone monitoring if you're going to do longer fasts. 24 hours is very safe. And I think for most people, including cachexic patients, I think everybody, even hospitals do this a lot. And relatives feel very worried when a patient loses weight, that this is because they're not eating enough calories. But cachexic patients can eat full calories and still lose weight, because it's an inflammatory process, and it's a metabolic dysfunction process. So because of that, they're losing muscle mass, they're losing protein. And I think that by reducing the inflammation, which fasting can be quite successful at, actually you could really help the cachexia, but it does need to be balanced very carefully with nutrients and calories. And for most of the time with fasting, I'd be happy to recommend up to a 72-hour fast, as long as people are drinking water, their electrolytes, we check their kidney function and everything else, and it's okay. I think longer fasts than like that, we've got some centers in America do much longer fasts for cancer. They're very monitored. They have hospital inpatient stays to do it. So I think that probably up to 72 hours is where I'm happy to recommend them, or otherwise under the guidance of someone who's very experienced in doing that with you. With water and electrolytes, most of us can manage a 3-day fast, and particularly around things like chemotherapy, that can be incredibly beneficial for outcomes and to reduce side effects. I think for most people going through chemotherapy, it's actually, the evidence is now very strongly supporting doing fasting during that. And so I don't know about it, how it is there, but here, most of the time people having chemotherapy, they're offering them fizzy drinks and cakes and things like that. It's just a bit of a disaster for the chemotherapy. So
like the opposite thing you want to offer. It comes from a place of love. It's like the language of love. You're undergoing this. We want to, give you things that make you feel good, which is the sweets and the treats. But in terms of the goal being, let's reduce your cancer and let's reduce the side effects of chemotherapy and improve the outcomes, I have definitely seen the research on that being extremely strong, that fasting around. And is it like around your chemotherapy being when, you have sessions of chemotherapy, right? You have your doses of chemo. Is it like just before you go into your chemo, you start fasting, or is it a few days before the chemo? How does that 72 hours, where do you position that around your chemo?
Optimal is 72 hours, and that is quite a hard fast for someone to get their head around to begin with, and I think if you're struggling with fasting, there are some fasting mimicking diets. Want to Longo does one, which is excellent, which we can use here as well, just to get you used to the idea of fasting. And if you're not sure, 24 hours might be more manageable, and that will have benefit. You could just do that the day of your chemo. The day you have your chemotherapy, just do a 24-hour fast and take it through that, and just drink water. And electrolytes can be quite important during that time as well, so using some electrolytes without sugar in them, and that can work well. If you can do the optimal, you do the day before, the day of, and the day after. So that would work for the 72 kind of hours. And that would be a brilliant fast if you can manage it. If you're feeling very weak, if you're losing a lot of weight, the 24 hours might feel more manageable initially.
And can you do bone broth during that time? Because it doesn't break ketosis, right? As long as you don't add things to it.
I think It's a bit debatable. I mean, I think for repairing the gut afterwards, it might be quite helpful because glutamine has some kind of split evidence on this. Some people believe glutamine drives cancer, but it can be really useful in the short term, particularly if you get a lot of digestive side effects. You can either take it just as a powder, or you could use some bone broth, can be a really good way, organic. Potentially coming out of that fast, do it a little bit shorter than the 72 hours and really, use the bone broth as your way to break the fast. That would be a great way to do it.
Okay, great. Thank you so much. And what would be your second? You mentioned you have three top ones. What's your second one?
Yeah, so I think that the second one is, so we've considered that sugar might be a driver to cancer. If you consider then another big driver is inflammation, then we want to, and inflammation's a bit like a sort of chronic inflammation long term is a bit like a smoldering fire in your body. And that stops your immune system working well. It damages your DNA and it makes a perfect environment for cancer to grow in. So many people who develop cancer, if we go back in their history, have had something that was quite chronic inflammatory beforehand. So what we want to do is bring inflammation down, because then your immune system will be more effective at killing cancer cells. And one of the best ways to do that is to use, dietarily, you can use lots of anti-inflammatory vegetables, and that's a great way to go with the antioxidants. But the most well-known one is curcumin, or a compound that's in turmeric. And I think taking that should be pretty much a staple, in my belief, for every patient, unless you can't tolerate it with cancer. So I would say that, and it's shown to enhance the effect of chemotherapy. So it's safe with many of these therapies, which really helps. So ideally, I would say take, it goes very well if it's with pepper. It's more bioavailable, and there's some really nice liposomal forms that absorb better, but somewhere around about 2 grams split through the day is a really good amount to take. And it's got some really good evidence. And it's shown to reduce tumor growth, reduce metastases, and interfere with those signaling pathways for inflammation. So I think turmeric's, a really great thing to add into it, and very readily available and cheap.
Amazing. Yeah, I think 500 milligrams 3 to 4 times a day would get you in that range, right?
Yes.
And
Yeah.
what about the omega-3 supplement? Because I'm huge into inflammation, and I find that one also, right, just so powerful.
Definitely, because what we know is omega-3 turns off those inflammatory pathways. So that's, you can you can do some of it through your diet, but I like to get my dosing quite high of omega-3. So when I do that, I go up to 2.5 grams. So I always think omega-3 is fantastic in there as well. But you like your oily fish, that should be part of your diet as much as possible anyway. Particularly that's the salmon, the mackerel, the anchovies, sardines, all of those fish are fantastic to put in.
Yes, I love the SMASH, right?
The SMASH acronym is wonderful that we learn.
Yeah, so
I have trout on the end, so it's smashed.
Yeah, I love
trout.
Anchovy, sardine, herring, and what was
trout.
the trout? Oh.
It's a bit difficult. It slightly ruins it.
Amazing. So again, summarizing that second principle, it's everything you can do to reduce inflammation, which is kind of like a modified Mediterranean diet. The modified is you're really upping your veggie and herb, like dill, parsley. Those kinds of herbs are very, very anti-inflammatory, which is so wonderful, and tasty too. And then doing some targeted supplement. And your top favorites are curcumin and omega-3. You would be also recommending in that higher dose, 2.5 grams. Which is very low risk of bleeding, and only people who have a predisposition for having heart disease might increase their risk with atrial fibrillation, but that's a pretty easy one to monitor. And if you start to feel any weird things in your heart, you can just bring down the dose and let your doctors, of course, know that you're taking these supplements. Hopefully you're part of a multidisciplinary program when you're dealing with your cancer, but if not, that's something you can just let your doctor know. Anything else to add about that second anti-inflammatory point?
I think diet is really, keto diet will bring down inflammation as well. I think it's realizing that even if you don't want to take the supplements, you're not sure, your conventional doctor's not sure, you can do an amazing amount with inflammation with your diet, and taking out inflammatory oils, making sure there's not too much sugar in it, eating whole foods as much as possible will naturally reduce inflammation, sometimes more than the supplements.
Absolutely. Sorry, go ahead.
Equally worth realizing stress drives inflammation. So we have to think about that mental emotional component that drives inflammation too.
What I'll do for the audience is I'll link my inflammation playlist in the caption below. And I've done a massive deep dive. I've gone to the anti-inflammatory diet, some supplements, as we mentioned, stress, toxins, supporting detoxification pathways. And again, just to reiterate, what Dr. Jess is talking about is the green keto diet, which still includes vegetables and, those green things like herbs, very anti-inflammatory, reducing those inflammatory oils, which is also a video in that playlist if you want to dive into what she means by that. Now, in terms of the third pillar, but before we go into the third pillar, I just want to emphasize that I'm 100% on board with you. Inflammation for me is either the root cause of health conditions, including cancer and other, all other chronic diseases, or at the very least, perpetuating and worsening the situation if it's there, right? Which it is there. If you have cancer, you pretty much have inflammation, and it could be localized in the area of the cancer. It could be affecting the body, could be spreading to other parts. So you may be noticing other symptoms like brain fog, inflammation in the brain, joints, tissues, stiffness. As you mentioned, the weight loss from the cancer is an inflammation response. So that piece, I think, I'm so glad you brought that up because it's so key. Now, what about that third pillar or philosophy?
I think the third thing to think about is how you would activate the immune system to kill the cancer cells. And that's what we all want to be doing at that point. And my third pillar is to look at one of the most well-known integrative oncology therapies in Europe, which is mistletoe. And I think that mistletoe is something I use in virtually, again, every cancer patient, assuming that they can tolerate it and assuming that they're happy to use it. And mistletoe has a really interesting history. It was originally found by Rudolf Steiner, and we have something in herbalism which we call the doctrine of signatures, which is that the plant looks a little bit like what it treats. And I think with mistletoe, that's amazing, because mistletoe, he was looking at a tree and he realized it had something on it that looked a little bit like a tumor that was like parasitic. And that's how mistletoe was found. And when he began testing that, he saw that it had anti-tumor activity. And that's been used a long time. And we now have multiple clinical trials, particularly showing that, one, it's super safe and it goes really well with other therapies, which is wonderful. And secondly, it improves quality of life and outcomes long term. And it's got anti-tumor activity, and it also is shown to enhance the activity of things like natural killer cells, the cells that kill cancer cells. So mistletoe to me is a fantastic therapy to add in to nearly all patients. And I wish that I don't know what it's like there, but it's only really used in Europe. It's not used in England, which is really irritating. They don't give it a standard of care here, and most doctors just say it's an alternative therapy. But if you go to Germany, for example, it can be given alongside in hospital settings there. And that is a bit sad to me that we don't do it here when it has more research than nearly any other integrative oncology intervention. So
wow, that's thank you for the history and the current state of affairs. I think that's beautiful. In North America, definitely in Canada, it's not standard at all. So let's take it through the gamut. Okay, let's take it through let's start with the person who's living in a country or in a place that doesn't have access to a doctor who would be able to help with this protocol. What could they do on their own? And then we'll go through to the protocol you use with your patients.
So, I mean, the diet is easy to do for everybody. Yeah. I think everybody can work on their diet. And I think if you're not sure about diet, you can, virtually talk to health coaches, nutritionists who are experienced doing this. Are you talking about mistletoe?
I'm so sorry. Yes. With respect to mistletoe specifically. Yeah.
Mistletoe is a little tricky because it's usually injected. So for the majority of people, but you can do it yourself. We teach patients how to do it, and you inject it into, it's subcutaneous. So it would go in the back of your arm. It would go in your thigh. Most of the time we do it into the tummy. It's a lot easier. And for people who are not sure about it, the needle is really tiny. It's not that bad. And I demonstrate it on myself using water to show it's not too bad. So it's, you would do that usually anywhere from 1 to 3 times a week. When things are a bit more aggressive, we go 3 times a week, even occasionally daily. There are centers that can do it intravenously, and that's shown to have potentially more benefit, but those are quite rare for us. I'm not sure what they're like for you. I don't think any better. And then actually research is now in stage 3 trials looking at doing it intratumorally, even injecting into the tumor. So mistletoe's got quite a lot of research behind it, but the subcutaneous route is a really great route. You could potentially either go to a doctor and then come back and order the mistletoe yourself. There are places you can get it. You can get it imported from abroad. Some of my patients can import it from Germany and they'll directly send it to you. So I think if you could find a doctor who'd show you initially how to do it and set you up on a regime, that would be an option. And even do telehealth. Many of us do telehealth anywhere in the world and can try and help you set you up with that. And give you some of the resources to be able to talk to your own doctors about what you're doing so that you can try and put that level of care together. Because the research is there to support this approach, and also that it's safe, which is the main thing that they worry about. So Although tricky to set up initially, once you get used to it, it's something that can be used long term. You generally start at a very low dose and then build that dose up. And you're looking for reactivity. People panic because it goes slightly red, but we want it to do that because it shows the immune system is starting to activate, which is what we need.
Amazing. So, what you're saying, it sounds like it's not something that people can just, for example, go and buy a mistletoe supplement and start taking it, or a mistletoe liposomal preparation or drink or anything like that. It has to be injected. Is that the only way it's been studied as being effective?
I mean, in herbal medicine, it did exist in herbal form, but it can be quite toxic. So again, so we've got to be careful. So I think the injected form is the best way to take it. And I think that that's where the research is. So that would be my recommendation for most patients, to have it in that form.
And is the needle the kind that, that really skinny, like insulin needle, so it's really, really,
really tiny. It's maybe slightly bigger than insulin needle, but it's not painful at all. It's not a difficult needle. I think I have some patients who are so needle phobic, their partners do it. They close their eyes and the partner does it for them, or their friend does it for them. There are other ways to get this done if it is a problem. But actually, most people get really used to it. It's not an issue. It doesn't, unfortunately, when you have cancer, needles tend to become part of life, but this is a very minor one in comparison.
Absolutely. So you would potentially start it as soon as you get your diagnosis, and it's any cancer, or are there certain cancers where you would not want to use mistletoe?
We do use it. We do use different forms of mistletoe. There's more than one form. There's a couple of companies that people tend to use. The two big ones are Iscador and Helixor. Those are the two most well-known brands. And they come from different trees. That's what's interesting about the different types. And some of those work better than other cancers. Naisha Winters has written an absolutely amazing book on mistletoe, which you can buy online on Amazon. And that would be a great resource. And it tells you by cancer which one might be more suitable, which I think is fantastic. And it's huge amount of evidence is all summarized for you. So if you're wanting to go down this route, you get that book, you can talk to your doctors with it. It's really well done. And equally, I think the ones that are a little trickier are blood cancers. The solid tumors are much easier. The blood cancers are a little bit harder. And equally, when you're doing it alongside a conventional therapy, we tend to use often a slightly different variety. So this is where you'd need a doctor just to guide you on which type would be best for you.
So they can reach out to you, which I'm going to be putting your contact information in the caption as well. They can get the book by Dr. Naisha Winters. That's NASHAWINTERS. She's wonderful. She healed her own cancer, which is so inspiring, right? Yeah. So mistletoe therapy, that sounds amazing. And plant medicine is just so fascinating. And so for the mechanism of action, can you remind me, is it that it activates a certain branch of the immune system that specifically targets cancer cells? Is that how it works?
Particularly, we know that it acts on natural killer cells, which are the cells, the particular type of lymphocyte that is very good for improving. They're the ones that kill cancer cells, but equally also dendritic cells. They're a bit like flags. So your immune system puts a flag on a cell and says this is a cancer cell, and the rest of the immune system comes to kill it. So they're shown to influence the activity of those two types of cells particularly. And also, as well as that, we have all of these other effects where they seem to improve quality of life, fatigue, sickness, and even some of the side effects of the conventional therapies. We don't really know how that works, but we do know that it does it in studies.
And you can take it if you're doing chemotherapy, you mentioned?
Yeah.
Wonderful.
And also radiotherapy. And it's got evidence to show that it's safe to do that. But again, you want to talk to your doctor and potentially have someone else help you with that.
Cool. Okay. That's wonderful. Thank you. And so lots of resources out there, which is fantastic. And then I have a few questions for you, but before I dive into the questions, is there anything else you want to say about those top 3 pillars?
I think what I would say is it's about the testing for the inflammation. One of the things that, Naisha's approach, she's really summarized it beautifully and called it the trifecta, that actually there's a set of inflammation markers that might be the most important markers to look at your tumor environment. And they are an HSCRP, which is an inflammation marker, an ESR, another inflammation marker. And last one is called LDH, and that can look at tissue breakdown and show more tumor aggressiveness. If you're testing those regularly and you're seeing improvements in those, you know your cancer is going in the right direction. Potentially before you even know a tumor marker or anything else will change. And she counts that trifecta as the most important set of tests you can do. And they're not that expensive as labs. So, when we're looking at inflammation, if we're regularly monitoring those and we're seeing them, we do them monthly in our clinic, then actually you have a kind of reassurance level before you get to your 6 monthly or, annual scan that you're doing, that things are going the right direction. And if something's going the wrong way in those, that's when you really need to think about the environment that's driving your cancer.
So the HSCRP and the ESR we can test in North America, and it's covered by public insurance. The LDH, I'm not familiar with. What does that stand
That's a
for?
lactate dehydrogenase. It's an enzyme.
Oh,
Can you do one
yes.
of those? I think it's quite common usually. It's one they used to do for, heart disease and other things. I think that
I'll look into that. Probably it is covered then. Maybe it's just fallen out of favor here. I don't see it
it's an
tested.
old test. It very much is. It used to
Thank
be
you.
on your routine labs and it used to be on ours too. And now it's like you asked for it, they look at you as though you've gone mad. But it was definitely when I started medicine, it was something we routinely tested. And now you can get it very easily. It's not expensive. If you go to most labs, they will do one for you. So most private labs, you can get a private blood test. It's not too difficult. And that's a really great test to do. Though just those three, if you're doing those regularly, very, very worth doing to check, keep an eye on things.
Wonderful. And it is possible to have cancer with those being normal. I've seen that actually just recently in a patient, not the LDH, but the ESR and HSCRP. So if it's high, it's helpful. If it's low, it's not helpful, but it's good to test just in case.
You might be seeing something else. I mean, the problem is that there are other things that can be driving that cancer, but I would say LDH is often a bit of a clue, and LDH has more components to it. It has something called isoenzymes. They're the individual components of LDH, and sometimes LDH looks normal, but when we break it down into its components, one of them's really low and one of them's really high, and that's showing us actually that it's just averaging out to look normal, but it definitely wasn't normal. So there is a little bit more to it, but I think it's rare for me ever to see that all three are normal and that cancers become aggressive. That would be unusual, very
Okay,
unusual
so
in the
it's
clinic.
a good sign if they're normal. So
Yes.
that's good. Okay, excellent. Okay, anything else you wanted to add before I ask some questions? Because that was very helpful what you just said there.
Nope, that's great. Thank you.
Okay, wonderful. So let's go into the questions. And by the way, if you're listening to this or watching this, pop over to the YouTube channel and in the comments underneath the video, ask any questions that you may have at the end of this video. I'll be sure to tag, Dr. Jess here so that she can answer some of these questions with me. And then it'll also inform us if we're going to do another interview, what kind of topics that we should cover. So your questions will help us decide, if we want to cover certain things in more depth. So one question that I have is, what about vitamin C? That's something that people often come across really early on, but there's concerns with, vitamin C IV. Is it acidic, so it'll worsen things? Does it interfere with chemotherapy? What are your thoughts on that?
So I think vitamin C has a huge role in cancer. And I think that, it's a long time now, but when I was a medical student, I did my honours research project in vitamin C and cancer, and which wasn't very popular with my medical school, but I did my project in it. And actually, the research goes right back to 1970s even. It's really old. Linus Pauling did some really fascinating research with an oncologist then called Ewan Cameron, and they did a whole group of end-stage patients and kept them alive quite a long time on very high doses of IV vitamin C. So this is a well-known strategy for long periods of time. And only more recently have people come back to it again and realized how amazing it may be. And it's not for, we have to consider with patients that unfortunately, I would say that once you start IV vitamin C, yes, it can be very helpful. It's quite expensive to do, but I think you probably need to stay on it if you've gone on it. So it has to be considered with the cost effectiveness of being able to do that. And we have to do a test beforehand to check something called a G6PD, which is an enzyme. If that's not right, then you cannot have IV vitamin C because it can cause bleeding. So that has to be checked before you even considered it. But even though it's acidic, it's an amazing antioxidant when it gets to a certain level. So initially, low doses, it's an antioxidant. That's when we take it orally. When we probably take it anywhere up to 15 grams. It's an antioxidant, which has benefits on your immune system. When you take it higher, it becomes a bit more oxidative. So it becomes a bit more like using your own natural cancer killing strategy. And actually then we can get into doses of 25 to 50 grams and we go up slowly to check you tolerate it. And I found then it can be immensely beneficial and patients tolerate it really, really well. And equally, if you want to look at some of the research of this, Dr. Paul Anderson has done some really amazing research online where you can go and read all the stuff on IV vitamin C because many doctors are scared, particularly around chemotherapy and other things of doing IVC. But he summarizes all the evidence really beautifully to tell you why that's an okay strategy to use and may even be beneficial. So,
yeah, no. And is there a contraindication with chemotherapy or?
Well, I use it alongside, and again, that can be controversial for some people. But again, if you read the research, it goes very well alongside it. So you can do the IVC and have the chemo, but you have to do that under the guidance. I mean, the dosages you're going into with IVC at these levels are quite high. You would need a doctor who knows what they're doing when they do that. And you would need to be able to go through the research to try and make that okay. It's tricky with the conventional system, I would say. And a lot of oncologists will say absolutely not.
Mm-hmm. And it was Dr. Paul Addison. How do you spell his last
Anderson, Anderson.
Okay, I haven't heard of him, so that I'll look into that for sure. Thank you for that. And are there any other, natural approaches that might safely complement conventional treatments like chemotherapy or radiation without interfering? Or
One
do
of
you?
my favorite,
Yeah, sorry.
yeah,
Yeah.
one of my favorite ones to use, apart from obviously the fasting, which we do with chemo, is to think about hyperbaric oxygen, particularly with radiotherapy. There's the evidence for that again is pretty substantial now, so it's quite hard. I've got a few friends who are oncologists actually, and even they are quite happy to recommend people to go and do hyperbaric oxygen because basically radiation works by creating free radicals. That works much better in an oxygen-rich environment than an oxygen-poor environment. Many of the tumor microenvironments, the environment the tumor's in, are very oxygen-depleted and oxygen-poor. So by oxygenating better, which you do with hyperbaric oxygen, which is basically in a tank where you've got oxygen going, and it drops the pressure. And by changing the pressure, you then oxygenate your tissues much better. So you're actually improving the activity of the radiotherapy when you do that. Equally, you're improving potentially because tumors thrive in a low oxygen environment. They don't do as well when you oxygenate the tissues like that. And lastly, hyperbaric oxygen really helps healing. So because radiotherapy can be quite damaging to the healthy tissues, by doing hyperbaric, you can actually improve the healing and prevent side effects from the radiation. And I would say if you're doing keto diet with it, there's some good evidence that ketosis really improves this too. So if you're not doing keto diet, you can drink ketone drinks and other things to cheat a little bit before you go in. But I would say being in ketosis will improve the effectiveness.
So the hyperbaric oxygen therapy, would you time that the day of the radiation or the day after? Is there an optimal timing for that?
It's a little tricky for patients often to get in. It depends. So I think as close as you can to it, basically. If you can do it on the day of it afterwards, that would be great. But if the next day, that's fine as well. You usually need quite a lot of sessions. You'll need anywhere from 20 to 40 sessions to get benefit with hyperbaric. So it's quite a lot of outlay for people. We have here some charities that run hyperbarics that can make that a lot cheaper. So it may be worth investigating to see if any of them do that. And you want to make sure chambers are not the same. So some chambers just go quite low to 1.4. You want to go to 2, at least 2 to 2.5 atmospheric ATA, atmospheric pressures, to get the benefit.
Oh, interesting.
That's a hard shell, always a hard shell to do that.
Right. Okay. Good to know, actually. For people who are low on income, right, and they're trying to prioritize where to spend their money, would it be appropriate to say, and correct me if I'm wrong, that it'd be worthwhile for them, obviously, to do the green keto diet with some intermittent, like some fasting, as you say, 24 up to 72 hours, of course, with a nutritionist, ideally, guiding you. The curcumin supplement and the omega-3 supplements, they're usually affordable for most. The curcumin, at least, you were saying. And then if you were to choose, would you do the mistletoe or the vitamin C? Like where, you know what I mean? Where would that be your biggest bang?
Mistletoe would probably, I'd go mistletoe because I mean, it's also that IVC is very expensive to do because obviously you've got to find someone to do the IVs. We have the lucky option that we can teach patients to do their own IVs if they're up for that, which is an interesting thing. We can train them and help them a little bit with that. But it's very expensive. And mistletoe potentially also helps you with quality of life. I would say mistletoe out of those two. Also, hyperbaric is expensive, but if we think that same principle through of the oxygenation of the tissues, exercise oxygenates your tissues. So you can do that for free. You can go for a walk. And many of those, like Radical Remissions books, the one thing all those people have in common is movement as that pillar. And it's always worth remembering that's because it oxygenates the tissues. So even if you are struggling to walk across a room, still have a go at pushing yourself to just walk and move as much as you can because it oxygenates your tissues.
Amazing. That is so true. And you're right. It's wherever you're at, can you increase your movement from that point without depleting your quality of life too much afterwards, right? So finding that little wiggle room that you have, using that to increase your oxygenation, that hopefully will provide you with more energy down the road for more movement. And then you're creating an upward positive spiral instead of a downward negative spiral.
Yeah.
Yeah, amazing. And then the other thing, like when you see this question here, how can natural approaches safely complement conventional treatments like chemotherapy or radiation without interfering? Is there anything else that pops up into your mind before we move on from this question?
Well, I started as a homeopath, and I would say one of the huge benefits of homeopathy is that it doesn't interfere with anything. So, people argue it doesn't work. I find it works extremely well. And I think that actually there's quite a lot of clinical studies that show it works quite well, randomized clinical trials. And the worst they can say is it doesn't have any effect, but you can safely use it alongside any conventional therapy. And I went to the Integrative and Personalized Medicine Conference this year. And what I loved is they had a French integrative medicine center for oncology. The guy came from that. He was amazing. And they've published all their protocols for free online to tell you how to deal with all the common side effects of chemotherapy, how to deal with many of the cancer side effects like fatigue and sickness. And they told you which remedies to take and what frequency and what dosage. So I think I can give you a link for that. And then patients could themselves go and find that resource and use those at any point and not feel worried that that's going to interact with anything that they're doing.
That would be lovely if you could send the link for that. I'll include that in the caption, and I want to check that out. That sounds amazing. I had a funny experience with homeopathy where I had a specific thing. I had a plantar wart, just sharing. I had a plantar wart. It was there for years. I couldn't get rid of it. Nothing would make it go away. And I tried Occidentalis thuja, Thuja occidentalis, tried the homeopathy, and it went away within 24 hours. And for me, I know, I was like, I'm a believer, and I don't know how it works. And I honestly don't care at this point because it got rid of this thing. And I had tried everything. I had tried the freezing, the night, all of the regular treatments, the salicylic acid. Goodness gracious, I tried everything. So this to me was like, I'm a believer. And as you say, the worst that could happen is that it doesn't work, because it doesn't cause side effects. And if you look at what homeopathy is, it's energetic medicine. It's the energetic imprint of the thing that you're putting into the water. And water does hold energetic imprints. Research has proven that. And so it's so safe and yet so powerful. It's like this paradox. So I agree with you 100%. Looking into homeopathy sounds like a wonderful thing. And anything else that you think would be useful to share?
I think always the mental emotional we've not talked about a lot, but is still my favorite part of everything. Yeah. So this is kind of goes with the next question, which is that if you ask me, number one, I love all the therapies that I do and I love the things that I'm trained in, but the more I do them, the more therapies I've learned, the more I want to focus on mental emotional with every single patient, because if there's one thing that will cause me a problem somewhere in there where the patient will start go off, it's always going to be related to trauma, to mental emotional, to things that they've experienced. If you can keep that side, you work on your mental emotional side, spirituality, connection with other people and community, social side, you can't underestimate how powerful that is for the healing experience.
I'm getting chills because when I speak to a lot of people with cancer, both loved ones and patients. And it's hard not to find this in people's history these days, but it can't be ignored that cancer often comes after a big traumatic shift, right? A big emotional event or a series of multiple ones back to back that on their own would have been manageable, but it's like another hit and another hit. Maybe it's like a disconnection from your support network over the years. And so everything has a gift in it, and it's hard to see the gift in cancer, but maybe the gift in cancer for some people is to reprioritize, reconnect, get reintegrated into your community, realize the gifts that we do have surrounding us, right? And so I agree with you 100%. Is there anything that you specifically recommend for people, like seeing someone for EMDR, cognitive behavioral therapy, like, is there any kind of thing that you specifically ask them to look into, or do you just highlight the importance of this and say you're going to find your own way through this, your own journey?
I think it depends on the spectrum from here. So if they've got a lot of trauma, I think the trauma work can be fantastic doing things like EMDR. But I encourage them to go and listen to some of the other philosophies on what cancer actually is in your body. And there's a really great person here who talks, he's an Ayurvedic doctor called Dr. Sam Watts. I would highly recommend people listen to him. He describes it beautifully, talking about, and homeopathy has this same theory that cancer cells have lost identity. So the person themselves has lost identity when they're in a cancer state. And actually, I would agree, having worked with cancer patients for a long time, they're the loveliest people. They were some of my loveliest patients. However, boundaries and setting boundaries and asking for what they want can be quite difficult. And I think that we can see that loss of identity sometimes in their history when we look at it, and erosion of boundaries, difficulty asking for what they need. So I think that journey is often part of the cancer journey for many of those patients, as well as dealing with traumas, because another theory that I've heard talked about a lot is that cancer is a non-healing wound, that it's a wound that won't heal. And if we look at that emotionally and trauma wise, then actually that also is another area to really consider when we think about cancer. And yes, these therapies help, the philosophies help. I think spirituality is a big part of it. You don't have to be religious, you can pick whatever resonates with you. But I think having some belief on why your body has gone down this route, on what your journey here is for, on what your purpose is, incredibly important to decide. If you want to live long term, there has to be something you're living for. There have to be goals that you're setting. There has to be some sense of what journey you're on.
I love that. Yeah, absolutely. And even just that, some people say a miracle is a shift in perception. And if you can shift your perception from this tissue in me is like, it's like a monster, it's devouring me, it's this thing I have to eliminate, to it's a piece of me that, just like me in the greater totality of things, has gotten lost and has, as you say, lost their identity or has a wound that won't heal. And if we can send love to that part of us, that part of us that is currently, as a cancer part of us, and rather than elimination, think of it as reintegration, just transformation, all of those things that we would want for ourselves as a whole, we would also want for that part of us, So I love that, because it can day to day, it can make the day to day part of living with cancer just that much more, not just bearable, but maybe even being able to find the joys within that. So thank you for mentioning that. And I definitely appreciate that highlight. And it's last but not least, for sure, because I believe that, there's many inputs to cancer. Yes, there's a genetic input. But the genetic is more often than not, loads the gun, but it's the environment that pulls the trigger. And so that can be an inflammatory diet, that can be unmitigated stress that we haven't learned how to manage, that can be toxins, supporting our detoxification pathways better. And that emotional piece, the body keeps score. Emotion is energy and motion in the body. And if you have things that are trapped, emotional wounds that aren't healing, and we haven't given ourselves the time to deal with that. And cancer basically is saying, you can't put this off anymore. You must prioritize yourself now. And this is like, this is the time. So thank you for that. That was, I think, very, very powerful.
Yeah.
Wonderful.
I think it's the most important. I think, honestly, if you asked me what I see as the biggest barrier for many people healing, I'd say the mental, emotional, and trauma from the past. Potentially also just being diagnosed with cancer gives you PTSD. I think it gives you some level of that, going through that experience, dealing with it, the shock that people are under when they have that diagnosis. And it's not always very well supported, definitely not here. I think that there will always be a trauma component to cancer that needs addressing. And then the fear that it comes back, the fear that drives you after that, that's a very important area to work on.
Absolutely. And there's the trauma during the cancer diagnosis and treatment, but then there's also a significant portion that happens once, if you're successful, when you're successful, the cancer is in remission, it's been treated, it's been managed, then it's like your body now has time to deal with the trauma, and the trauma can play out the days, weeks, or months, or even years after that. So staying attuned to that, being aware of that, and bringing in those resources at the right time, I think can be very beneficial.
Yeah. I think so too.
Anything else that you would like to say to our audience, Dr. Jess? This has been just absolutely wonderful. So thank you. But I want to just give you the opportunity to finalize things for us, if you'd like.
I think really we just always encourage the process of testing first to check that you know what's going on. And then remembering that cancer didn't just happen. It was something that the environment has been changing for probably at least 10 years before this cancer developed. So when you have all the treatments for cancer, you may be successful, but to stop that coming back, to take some control back over your health, you have to change that environment back inside your body so that it doesn't grow cancer again. And so that in a way, the soil isn't hospitable to the seed of cancer.
Absolutely. It's changing the chemistry in your body, and the inputs of chemistry, as we know, is the diet, the things you put on your skin, what you breathe in, what you drink, your thoughts, changing the internal chemistry and all those things. So absolutely, as you say, it's like a garden. We want all of the beautiful flowers to grow. We want to take out the weeds, say, thank you very much for being here. You've told us that the soil isn't working out well, but we're going to pull you out and we're going to fix the soil so you can't come back again. So I love that. Where can people find you? Do you have social media platforms that you like to share?
So if this has resonated with you, then I'd love to connect you. I have Instagram's my favorite platform. So my handle is drjess_natural doctor, and you can DM me directly, and I'm happy to give you, if you just mention this podcast, the Wild Wisdom podcast, then I'm very happy to send you some resources there as well. So yeah, just contact me through that. I have a website if you want to look at the website, which is drjess.co.uk.
Amazing. And thank you so much for coming today, Dr. Jess. I can already tell that many people are going to benefit from this wild wisdom that you've shared with us today. And for you, the audience, if you enjoyed this, please head over to my YouTube channel, Dr. Patricia Mills MD, and subscribe. That's the best way to support the Wild Wisdom Show. Save this for future reference and share. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. Thank you for joining us today. I hope you have a wonderful rest of your day, evening, or night, and I'll see you next time. Bye now.